This is my second speech, and it's a new discovery in my major of psychology. It's called postpartum depression. Did you know that 80% of women go through postpartum depression after giving birth? Postpartum depression is temporary depression related to after giving childbirth. The reason why I decided to talk about this is because I recently came across this with my sister giving birth. I found this very interesting, and with my major being psychology, I decided to do more research in this topic. Today I will be talking about what is postpartum depression and what are the symptoms of postpartum depression and how it can be overcome. First, postpartum depression is depression related to giving birth. Postpartum depression is much more common than people realize. It can take up to a few weeks or months after giving birth to even start to notice symptoms. According to an article in Medical News Today, it can also be found in 10% of new fathers. Postpartum depression is mainly caused by hormonal changes and lack of sleep. Postpartum depression is more likely to happen to women that have suffered from depression before or emotional and distressful events. There are also many symptoms in postpartum depression. Many of the symptoms are the mothers have lack of interest in themselves and the baby. They feel overwhelmed and trapped. These women feel guilty, having trouble sleeping, and they also cry a lot. Only about half of these women might have thoughts of harming themselves or the baby. Postpartum depression can be diagnosed by having doctors do blood work to see if the level of hormones has increased. Also, doctors can ask questions related to how a woman is feeling. Finally, it is important to know how to overcome postpartum depression. Many of these women feel ashamed to talk about how they're feeling to others. According to medical research, postpartum depression is treatable and curable. It is very important for these women to keep in touch with their doctor and to talk about how they are feeling. There are two main treatment options for postpartum depression: taking prescribed drugs or going through therapy. And many of the women who overcome postpartum depression with antidepressants, which can take up to several weeks to take effect, breastfeeding while using any drugs is not allowed and can be harmful to the baby. Also, in more severe cases, some women go through therapy to help them deal with the situation. It's more effective to do both. In conclusion, postpartum depression is very common in women in the United States. It's important to detect and talk to loved ones about it. Postpartum depression is definitely treatable and curable. Most symptoms go away within weeks after receiving the right help.
Good job, Chris.